welcome to SVG-TV News for Wednesday, September 18th, 2019. I am Yvette Boynes with the details. Cabinet has approved license for another group of investors in the SVG medical cannabis industry. A news release from the Medicinal Cannabis Authority said of the new medicinal cannabis license issued to our traditional cultivator groups comprising 39 members and 16 individual farmers. The authority said this brings to 173 the number of traditional cultivators who have so far satisfied the requirements, making them eligible to legally cultivate medicinal cannabis. According to the authority, a traditional cultivator's license allows for medicinal cannabis cultivation of up to 5 acres and is offered on preferential terms of only $100 processing fee with no license fee attached for 2 years. It also guarantees a secured market as investor license must purchase a minimum 10% of their raw cannabis material from traditional cultivators. The recent approvals cover applications to cultivate in areas ranging from Richmond on the leeward side of the island to Georgetown on the windward side. The authority said the SVG medicinal cannabis industry continues to progress apace with approved operators now engaged in preparatory work to commence cultivation and manufacturing activities soon. In the meantime, the authority said it continues to push forward with capacity building and research analyses in order to ensure that licensed operators meet international standards and the industry remains a healthy one. While the establishment of the SVG medicinal cannabis industry is said to be progressing well, understanding of the laws governing the industry is said to be lacking. At yesterday's media conference, Prime Minister Dr. Ralph Gonsalves said persons should educate themselves on these laws so that they do not find themselves on the wrong side of the law. He used the opportunity to further explain aspects of the amnesty laws, which he said are being taken out of context.
Amnesty law kicks in when people who are cultivating, who have received, and they're traditional cultivators who have received licenses individually and in group, that they kick in when they get those licenses and they start and they make the application for the amnesty. That's when the amnesty kicks in. The fact that a man grow weed and they catch him at sea. They catch a man at sea with 10, 15, 20, 30, 40 pounds. The amnesty don't apply to that.
The PM said under the laws, persons can have up to 56 grams of marijuana in their possession, which does not warrant any charges.
It's for having in their possession 56 grams. That you do not get arrested for, you don't have a record for, and you can't be imprisoned for. Not 10 pounds, not 4 pounds, not a pound. 56 grams, 2 ounces. That's what it says. The public policy there is to treat that as a health and educational issue. And under the International Convention, it is permissible to proceed like we are proceeding.
The PM further stated that the Attorney General's office is in the process of preparing a special card that will be given to persons who are found with a small quantity of marijuana in their possession.
But you admit it's yours? Fine. There's a card. On this side, it says the misuse and abuse of cannabis may be dangerous to your health. Educational information in this regard can be found at 2-3 places. There could be sites as well as there could be physical places. The flip side of it, we deal with the health aspect. It should say at the top that If you are under 18 and you appear reasonably to be dependent on cannabis, you may require counseling. Counseling services are available at. There will be a general educational program also.
Prime Minister Dr. Ralph Gonsalves has expressed concern with what he considers exorbitant prices funeral homes in this country charge to bury the dead. At a news conference yesterday, the Prime Minister said he has taken note that many persons end up in debt to bury their loved ones, and this should not be.
To see the cost of it, and if I could buy one before I'm dead, so I put it aside to bury him. I want even in debt to rebel against this ridiculous. You don't know. Well, you all should know me by now. We're with each other all the time. You know, things which I don't like to see money waste. And there are a lot of these funerals. People waste too much money. And the funeral parlors are just adding additional things. For more and more money, this thing is, say you bury somebody, you end in debt. Serious debt. The money you collect from NIS and bond ban should properly be able to bury you.
The Prime Minister also noted that times have changed when burials were simple and inexpensive, adding that the state on many occasions had to pitch in financially to help families bury their loved ones.
The official funerals, there's a range between which people would ask for assistance from the state. And the cabinet secretary deals with these things and advises me, and I give the nod upon the basis of the advice. I don't get involved. I don't get involved in these things. Though from time to time, not families, but people on behalf of families would call me and ask me how much the government is going to put to this particular funeral. I say, I don't deal with that as a cabinet secretary, so I don't get involved in those things.
A high-level mission from the European Union is expected to visit St. Vincent and the Grenadines tomorrow, Thursday, September 19, 2019, to assess some of the EU's investments in the country. The delegation will include Directorate General for International Cooperation and Development, Stefano Manservisi. Manservisi will be accompanied by the New Europe and Head of Division for Caribbean Countries, Felice Zacchio, Head of Delegation and Political Advisor from the Delegation of the European Union to Barbados, the Eastern Caribbean States, the OECS, and CARICOM-CARIFORUM Ambassador Daniela Tramaco. Medical Dr. Mishka Duncan Adams is encouraging women, particularly those who are thinking about getting pregnant, to protect their babies against sexually transmitted diseases and other infections. Dr. Duncan Adams was at the time delivering a presentation at a symposium yesterday hosted by the Ministry of Health, Wellness and the Environment to commemorate Caribbean Wellness Day, which was observed last Saturday, September 14th. Dr. Duncan Adams said sexually transmitted diseases such as herpes can create lifelong harm to a child, and it is important that the necessary steps are taken to protect them from the womb to birth.
Infections during pregnancy. Now, some persons acquire different infections which we consider, like, for example, torch, toxoplasma, rubella, herpes, etc. Cytomegalovirus. These are different viruses that can affect an individual during pregnancy, or syphilis, hepatitis, etc. Right? And these obviously can be transmitted to the baby. For example, these infections can cause growth restrictions in babies. They can cause the babies to have future problems when it comes to seizures, smaller brains, developmental delays, etc. Other infections like urinary tract infections, thank you, are also something that needs to be addressed because it increases your risk of premature births and of babies that are born with sepsis as a neonatal infection, right? That increases the risk of death.
HIV is another STI which can affect a baby inside the womb. Dr. Duncan said there are ways to prevent the transmission of the disease to the baby, noting that prevention is always better than cure.
HIV, it's always important to know your status, and if a person is HIV positive, would need to be treated during pregnancy and even before pregnancy to decrease the risk of your maternal fetal transmission. So there's still the possibility that if you become HIV pregnant and you have a child, that your child may be free of HIV if we are responsible enough to take our medications during pregnancy, and then when the baby is born, we put the baby on what we know as prophylactic medication, preventative medication. And it has been shown that it decreases the transmission from mother to child of HIV, right? But obviously, as we say, prevention is better than cure. So if you can be responsible for your health and protecting yourself and knowing your status when it comes to HIV, then obviously it annuls the risk.
A person's dental health is important to his or her overall health. With this in mind, the Public Health Dental Services will be engaged in a week of activities to educate persons on the importance of oral health care. The week of activities will be held under the theme, Saving Smiles, Healthy Body, Better Sweets, Better Smiles, Better Life. The activities will begin on Sunday, September 22nd with a church service and continues with school visits on Monday and Tuesday, a dental health fair on Wednesday at the Old Treasury Building site, educational sessions at polyclinics nationwide on Thursday, culminating with a dental family fair on Friday, September 27th. Acting Senior Dental Surgeon Dr. Brendan Richards said along with blood pressure and sugar checks, persons will receive screening for various conditions as other useful information relating to their dental health at next Wednesday's health fair.
So general screenings and the information. We have a number of pamphlets that we will be giving out that focuses on oral health and how it relates to other aspects of health. And there would be a lot of sessions there where you can interact. We're also inviting as many persons who are interested in dentistry as a career. There would be a booth there that would give information to that effect. We are hoping to have the guys that generally are on the courts that sell their basket of fresh vegetables to have a booth there as well, and to promote the whole idea of better sweets, more of our ripe bananas, more of our natural stuff versus the candies.
Dr. Richards said it is hoped that the week of activities will help to promote a more proactive population who takes better care of their dental health.
It's not so much the issue of dental caries, because that is prevalent worldwide, and gingivitis. It is the attitude that most patients have towards oral health. The problem that we have is that most of us only come to the dentist when it's aching. And we would want to change that. We want people to come not just when they're having pain, but to come when they're healthy. Because that we're able to keep them healthy longer. So we are really enforcing the, come and visit. If you can't get to a public dentist, go to a private dentist. The important thing is that you visit the dentist. It is extremely important.
Dr. Richards said the polyclinic educational sessions will be used to help change the public's perception of dental health.
That we think is really crucial when it comes to nursing and pregnancy. Most mothers think that during pregnancy they ought not to visit the dentist. We're encouraging them to visit the dentist. That's the time they ought to be visiting the dentist, because a mother that has a sick mouth is not and would not be able to feed that unborn child properly. It means that child is going to have poor nourishment because the mother herself is not adequately nourished. So we want our mothers to have healthy mouths so that they can have healthy babies that are born with healthy weights and with all of the nutrition that they would need. We are also would be focusing on not just the diabetics and the hypertensive and the nursing mothers. We also be dealing with all those areas that concern cardiac well-being, giving information as to how best we can take care of ourselves.
300 sheets and 300 pillowcases were handed over today to the Milton Cato Memorial Hospital on behalf of the St. Vincent and the Grenadines Reading Association based in the United Kingdom. Permanent Secretary of the Ministry of Foreign Affairs Sandy Peters Phillips handed over the items on behalf of the association to the Deputy Hospital Administrator Andrew Williams.
On behalf of the St. Vincent and the Grenadines Reading Association in the United Kingdom, 300 bed sheets and 300 pillowcases as donation towards the healthcare at the Milton Cato Memorial Hospital. Is expected to increase the linen stock at the Milton Cato Memorial Hospital, making the patient a little bit more comfortable. And the ministry is committed to continue to collaborate and work with the Ministry of Health and other partners who are willing to assist to ensure the further development of our hospital in the sense of donation, etc. Thank you very much.
The Deputy Hospital Administrator expressed gratitude for the donation.
Particularly thank the donors, the SVG Reading Association in the UK, for donating again, some sheets, 300 I understand, and pillowcase, 300 as well, to the hospital services. When I say hospital services including Milton Cato Memorial Hospital, the Georgetown Diagnostic Center, and the Chateaubriand and the Levi Latham hospitals. We are so grateful for this important gesture. I know in the past we would have received donations of various sorts. Sheet is one of the more important aspects of donations that we can receive. Sheets are not disposable, but from time to time they would wear and tear, and even our homes they would deteriorate. And I was advising the Minister of Foreign Affairs, Honorable Minister Straker, in the previous donation that we have systems in place to control the use of sheets. But however, from time to time, as any other hospital, they would deplete from time to time. So this donation is timely, and we are most grateful for this donation.
Local historian Dr. Adrian Fraser will tomorrow launch his latest book, From Villain to National Hero, Châteauguay and the Early Struggle for Independence of St. Vincent. Tomorrow's launching ceremony will be held in collaboration with the UE Open Campus SVG and will take place at the French's House from 6 p.m. The book traces the transformation of Châteauguay from villain as seen through colonial text to his status as SVG's first national hero, and makes the point that the early struggle for independence began with Châteauguay. The UE Open Campus said the book also helps to broaden the concept and meaning of national independence and is dedicated to the 40th anniversary of SVG's independence.